doctor, the fact that you're young, people will look at you like, is it this person that will manage when you come face to face with your patients, you're fidgeting, you're sweaty, you're jittery. I, as a patient, will not sit down on your chair to work on me. Nobody knows that you're the best graduating student. Nobody knows that you made distinction in surgery or that you were the best in pathology. In one of my videos, I shared some of the things to look out for when you're trying to pick a place for your housemanship. I'm going to be leaving the link somewhere in the description box below. So in that video, one of the things I mentioned was clinical skills, like where you're going to gain a lot of clinical skills. So in this video, I'll be sharing with you things that you're supposed to be doing during your house job here. The first thing is to learn clinical skills. Like that is basically the reason you're doing your housemanship, to gain more clinical skills, to develop confidence in patient management. So if you're doing your house job and you're running away from, doing some procedures and all of that, you're shooting yourself on the leg. I also have a video where I talked about top mistakes that young doctors make. You can also see that video for yourself. Now, clinical skills are very, very important. They are basic things you're supposed to know how to do as a doctor who is out of school. Not like you're supposed to be able to like do some advanced procedures, but basic things like common things occur commonly. In most cases during NYSC, you're likely going to work in a primary healthcare center. So cases you're going to see are likely going to be like some of the like really, really basic cases. But regardless, you should be able to perform some procedures. Housemanship is not the time to lounge, honestly. It's the time to learn. And of course, you won't even have the time to lounge even if you wanted to. So the 1 year is going to pass, so make it count, make it be worth your while. Don't just glide through it and let it pass you by. Make every second, every moment of it worth your while. The second thing you're supposed to do during housemanship is to develop confidence. See, confidence is so important in patient management. When you're working, when you're in the clinic, or when your patient walks into the clinic or whatever, nobody knows that you're the best graduating student. Nobody knows that you made distinction in surgery or that you were the best in pathology. Nobody knows any of those things. And to be honest, at that point where you're supposed to administer care to your patient, it is not very consequential. I mean, it's good to do exceptionally well in school, right? But confidence is so important because it makes no sense that you have this stellar results, and then when you come face to face with your patients, you're fidgeting, you're sweaty, you're jittery. I, as a patient, will not sit down on your chair to work on me because, generally speaking, when patients come to the hospital, many of them are apprehensive already. They are coming because they want a solution. So how is it that you, who is supposed to prefer the solution, you're now scared? That's not nice at all. So housemanship is when you build your confidence, and you can't build your confidence on emptiness. It's still hinged on having good clinical skills. So if there is a case that you can manage, right, of course, the more you manage this case, you would gradually build confidence in managing that case. But let's say you do not have that clinical skill, then you're likely going to be scared in performing those procedures. So that is why you need to gain good clinical skill. You need to apply yourself to learn your hands-on as much as you can, especially if you're in dentistry, because dentistry is basically hands-on. It's not like GOPD where you can maybe prescribe medications for people and then they'll go and they'll come back and they're feeling fine. Drugs don't cure toothache, right? So you should be able to do like the most basic things that you're expected to do on your patients. And then there is a thin line between confidence and arrogance, right? So you have to find a balance, find where to be. Now, there is this thing about being a young doctor. The fact that you're young, people will look at you like, is it this person that will manage me? In fact, I've had cases where I walked in and then my patients, they just looked at me like I could tell that they were sizing me up. And to be honest, it didn't really matter to me. It didn't matter to me, right? So they sat on my chair and then I started attending to them. And by the time I was done, they were all happy. They were all grateful. In fact, when they got married, they got me their wedding souvenir and all of that. So like, you have to know what you're doing. You have to be confident, right? Like I rightly said, your confidence has to be built on your level of experience. And that experience is gained through application, through applying yourself and trying out your hands-on skill as much as you can. House job is the time to gather all that skill because most times you don't even know where you're going to serve during NYS. And you may not get the chance to be under somebody. You may be the only one there if you're a dentist, depending on how big or small the facility is. So you should know how to do some of the basic things that are expected of you. And confidence is so important. Like you need a great deal of confidence because let's say you walk into a place or you have a patient sitting in front of you and then they are sizing you up or they are looking at you like you don't know what you're doing. And then you yourself, you're not even confident enough. it's going to have a ripple effect, because now if you're not confident, your patient will not have the trust to be very compliant with you, right? And if your patient is not compliant with you, it's also going to affect the quality of care that you're able to give them. So let's say you expect them to do a certain thing and they don't trust you, they're likely not going to do those things. And if they don't do those things, they won't get the desired result, and it will seem like you don't know what you're doing. And of course, it's also going to affect how responsive they are to the care that you're offering them. So I know it's a two-way thing, but a good chunk of it depends on you. In those procedures you were scared of during school, like during clinical class, housemanship is the time to like prune those skills. It's the time to face them head on, because after housemanship, it's like you're being thrown into the woods. You're all there by yourself. And being a clinician without skills is like a farmer without his tools. Like, I don't want to say you're useless, but of what use are you to your patients if you cannot confidently administer care to them? Housemanship is also the time to decide on what you want to do with your life. Now, I can understand that when we were in school, you're not very certain. You don't even know what the practice is like, because I mean, you're juggling academic work in school and clinic work, so you're not really full time in clinic practice. But I mean, in school, you have an idea of what clinic life is like. House job is when to make up your mind. Do you really want to continue in this career path? If you're going to continue, do you want to specialize, or do you want to be a general practitioner? Do you want to own your practice? Some of these things are not entirely in our control, but you're not going to live your life to fate. You're going to have to make plans on your own for yourself, right? It may not exactly work out the way you plan it, but just put in effort, right? So during housemanship is when you want to decide, do you want to dapa? Where do you want to go? Do you want to further? Do you want to do your masters? Do you want to go into residency? Are you going to write primaries? Are you going to write national or West Africa? So all these things are the things that you want to know. What are the pros and cons? Why should I write this over this? Am I going to write the two? What department do I want to specialize in? What kind of life do I want for myself? The specialty I want, is it going to be in line? Because now that you're in practice, you're seeing those things firsthand. So let's say you want to be an anesthesiologist. So you're asking yourself, okay, will I be able to take the random calls? Will I be able to be in the theater for as long as it's going to take? Oh, I want to be a maxillofacial surgeon. Oh, it sounds cool, right? Am I going to be able to put in that amount of work, come to the clinic by 3 a.m. because I'm the one on call to attend to emergency? Do I have the heart for it? Is this something I really want to do? Because we know that basically every specialty they earn the same thing, right? But generally speaking, if you're working for the government, they are not going to say, oh, because you're this, we'll pay you more. Once you're a doctor and you're in a certain cadre, you're earning the same thing, right? So you're now going to ask yourself, is this something I really, really want to do? If I don't want to do it, do I want to travel? If I'm going to travel, what are the prospects for me? What are steps I need to take? Do I have to write PLAB? Do I have to write IELTS? If you're a dentist, you have to say, okay, what country would I want to practice in? What are the challenges in that place? What exams do I have to write? What requirement do these people have? So housemanship is really the way to like put these things in perspective. Do you want to serve? Do you want to do your NYSC? If you do not want to serve your fatherland, what is your next line of action? What plan do you have in place? Like, these are the things you want to put into perspective during this your 1 year housemanship. So I don't know if I'm forgetting anything. And of course, build relationships, very important. So you're going to be meeting people from different walks of life. Build good relationships, like build relationships, because this career, like, you know how when we're taking our oath, they told us that our colleagues are like our brothers and our sisters. That is how it is. These are the people that will look out for you when push comes to shove, right? So build good relationships. Don't go there and start causing trouble. I think I'm going to make a video on things you're supposed to do in the corporate world. I don't know whether that's going to be the title, but yeah, something about how to navigate, the corporate world ish, because housemanship is like entry level employee kind of thing. So this, like, for many people, this is the first time they're getting into the 9 to 5 and all, and they really don't know what to do or what to expect. So maybe I'll make a video on that subsequently. But yeah, these are like some of the things you're supposed to do during your housemanship. In summary, gain clinical skills, develop confidence in patient management, decide on what you want to do with your life, whether you're going to specialize, whether you're going to be a general practitioner, whether you want to leave the country, whether you want to stay back in the country, whether you're going to do your residency, that's still specialization. And yeah, whether you're also going to serve or not. So just put all these things into perspective and make it count. And of course, build meaningful relationships and decide on what else you want to do. Like, if you don't want your whole life to revolve around clinical practice, there are other things, there are other pathways that even as a doctor you can still be practicing, but maybe not in the clinic. So all those are things that you can explore during your housemanship. So yes, Take care of yourself. And if you are somebody who has been in the practice for a long time, I want to know in the comment section some of the things you did differently during house job that you think anybody watching this video would benefit from. Of course, if you've also done your housemanship, let me know some of the things you think people who are about to start or presently doing their housemanship should know in the comment section. Take care of yourself and don't forget to subscribe to my channel, like this video, and share with anybody you know that will find it very useful. Bye.